Good morning, good afternoon, good evening, viewers from wherever you're watching this from, and welcome to the inaugural issue of Something About Surgery Beyond the Scalpel. This is a conversation about surgical service other than the surgery itself, born of the understanding that before a patient lies on the operating table to get surgery, they have interacted with numerous healthcare staff, and afterwards they will interact with numerous healthcare providers, consume numerous resources within the healthcare ecosystem. That understanding all this is important to the delivery of surgical service. When I was an undergraduate, my professor of surgery said this statement that I keep to date: a serious hospital is one that has a theater. Now, I never understood the enormity of that statement until I became a surgical service provider or a surgeon, both in training and currently as a fully fledged consultant. Every single day, there is an extra bit of service, an extra bit of paperwork, an extra bit of examination or investigation that is required for this surgeon, for this patient, or the other. It is impossible to exhaust them. Today, I would just want to introduce the arrangement of the surgical service. Other than the team, what are the critical components of any surgical service? There are three of them in terms of infrastructure and systems. One, the outpatient unit. Two, the inpatient unit or the ward. And three, the operating theater. Inpatient department, outpatient department, the operating theater. Now, without an operating theater, then you don't have a surgical service. All you will do is refer. The reason why the theater is the epicenter of the surgical service is because it can exist in the absence of the other two. For instance, if you have a private hospital that has admitting consultants from all over town, that hospital does not necessarily need to have an outpatient department, because there are consultant clinics and offices in town where they sit, see their patients, investigate them in readiness for surgery, acts as an outsourced outpatient service. The patients will come from those consultants with a referral note and get directly admitted to the ward. Then they will get to theater, recover, get discharged, and they won't come to the outpatient of that hospital where they got the surgery from. They will go back to the clinics where they were seen by their consultants from. So you can actually do away with an outpatient and still run a surgical service, but collaborating with those consultants or surgeons. Can you do away with an inpatient service and still offer surgical service? Again, yes, but then you need to offer minor surgical service. And some of you might be familiar with procedures like endoscopy, procedures like small biopsy, where someone will show up in an outpatient setup. They have a lump that's growing on their skin, and they are told this can be removed surgically under a little numbing medication called local anesthetic. And they will have the surgery and they will go home without stepping in the ward. But at least they will have gone through what is called a minor theater. So there is a theater. We have daycare centers that run quite a number of minor procedures in outpatient minor theaters without the need for a ward at all. The patient will come, they will get prepared, they will get their endoscopy, they have a recovery room, and they go home. The other one will come, they will get a local anesthetic, they will have their lump excised, they will get their pain medication, they will relax for a moment, and then they will go home. Day in, day out, there is a surgeon, there is a space for operating or the theater, no ward. Theatre becomes the core component of provision of a surgical service unless you are just screening patients and referring them for surgery, in which case then you are not offering the complete package of surgery. That is the arrangement of the surgical service. Next, we are going to discuss about the arrangement of the surgical teams. Thank you. My name is Dr. Stanley Aruyaru, and this is Something About Surgery.